Retinal vein occlusion. The eye is made of parts that receive and focus light on the retina, and the retina which perceives the light and sends the signal to the brain through the optic nerve. The brain perceives the object that we see. Like any other part of the body, retina, which is key to vision, is also supplied by blood vessels. The retinal vein is one such blood vessel that drains the eye. When the retinal vein gets occluded or blocked, because of various reasons, which we will discuss in further sections, the blood is not drained from the retina, which damages the retina, and it is called retinal vein occlusion. It is the second most common blood vessel-related blindness. A doctor can see bleeding, swelling, and fluid leaks when he examines inside of the eye using a scope in retinal vein occlusion. Patients suffering from retinal vein occlusion may experience blurring of vision or blindness in part or all of the eye. There could be dark spots or lines floating in the field of vision. Patients may also feel pain and pressure in the eye. Symptoms of retinal vein occlusion develop suddenly without any warning. A thrombus or blood clot blocking the blood vessel is the reason for retinal vein occlusion. Depending on the place of blockage, retinal vein occlusion is of two types: central retinal vein occlusions, or CRVO, where the main retinal vein is blocked, and branch retinal vein occlusion, or BRVO, where the branch of the retinal vein is blocked. In rare cases, the vein draining half of the retina may get blocked, which is called hemiretinal vein occlusion, or HRVO. Some of these factors increase the possibility of formation of thrombus and blockage of the retinal vein: smoking, overweight or obesity, older age, hardening of blood vessels, glaucoma, lymphoma, a kind of tumor, a blood condition called leukemia, a condition called multiple myeloma, and injury to the eye. A detailed history would be taken by your doctor to know the symptoms you are experiencing, and also to see if you have earlier mentioned risk factors like smoking, etc. On fundoscopy, inside of your eye is examined. The doctor will put an eye drop to dilate the pupil and explore inside of your eye. Fluorescein angiography is another test performed to visualize the blood vessels of the eye. In this, a harmless dye is injected into a blood vessel in the arm. The dye travels to the blood vessels of the retina. Then, an instrument captures the image of the retina, in which the doctor can visualize if there are any fluid leaks in the retina. Some patients may need another test called optical coherence tomography. In this test, pupils are dilated using an eye drop. Then a machine scans the retina to make a detailed image of the retina. The doctor examines the image and identifies the abnormalities. On detailed examination, the doctor may find swelling of part of the retina called macula, blockage in blood vessels, leaking blood vessels, growth of new blood vessels, and bleeding on the retina. Avoiding risk factors and maintaining a healthy lifestyle are the first steps towards the prevention of retinal vein occlusion. If retinal vein occlusion has already developed, preventive measures can help to minimize worsening, development of complications, and development of the condition in another eye. If you are a smoker, stop smoking and avoid secondhand smoke as well. Keep blood pressure, blood glucose, and cholesterol levels under strict control. If you are suffering from glaucoma, keep it under control by sticking to the treatment suggested by your ophthalmologist. If you have already developed retinal vein occlusion, strictly follow doctor's advice so that you can prevent it from happening in another eye. Anything healthy for the body is healthy to the eye. Healthy eating and regular exercise are essential for the health of your eye. Unfortunately, retinal vein occlusion can't be cured, which means the vein cannot be unblocked. However, With the treatment, complications can be avoided and damage can be minimized. Retinal vein occlusion is treated with local injection and laser therapy. These treatments help to restore vision in a few months in some people, and some may experience permanent vision loss. A drug called vascular endothelial growth factor is injected into the numbered eye using a very thin needle. The injection reduces the fluid buildup in part of the retina called macula. Reduction in fluid buildup helps you to see better. The drug also helps to reduce the swelling. A steroid injection may be given to reduce the swelling. There are leaking blood vessels and new blood vessel growth in retinal vein occlusion. Leaking or new blood vessels are burnt using laser to avoid further damage. Unfortunately, retinal vein occlusion does not come with warning signs and symptoms, but it attacks suddenly. Moreover, there is no cure for retinal vein occlusion, but damage already done can be controlled. Controlling risk factors and following healthy lifestyle are very important. Last but not the least, regular eye checkup is critical to avoid any eye problem. A routine eye examination is essential, especially if you have risk factors that can damage eyes such as smoking, cholesterol, diabetes, and hypertension. Issued in public interest by INTAS, from the makers of Razumab.